Assalamu alaikum. Hope you all are doing well. Welcome to PMC Online Academy. I am Dr. Mariam Tahir, CEO of PMC Professionals Hub. Today we are going to start our day 2 of Physiotherapy 360-degree Foundations, Importance and Global Scope. The topic for day 2 is Domains and Specializations in Physiotherapy. Topics we covered in this day 2 lecture is core branches of physiotherapy, musculoskeletal, orthopedic, neurological, cardiopulmonary, pediatric, geriatric, women's health and pelvic floor rehab, sports physiotherapy, specialized emerging fluids, vestibular rehab, pain management, palliative care, oncology rehab, rules, techniques, and clinical examples from each domain. This activity you have to perform at the last of the lecture after you heard, and you have to respond in the comment section. That will be your attendance to be qualified for the certificate, which shows that you have listened all the lectures completely and carefully. So find your interest quiz, helping candidates identifying their area of passion in physiotherapy. After this lecture, you will be able to identify that which field you choose or which field you like the most to go with. Okay, you have to write your interest on the topic you are interested, you decided, okay, and you have to write a paragraph or 2 to 3 lines in the comment section about that. So, what will be the learning outcome? Participants will be able to recognize various physiotherapy fields and importance in patient care. Okay, you will be able to know about the different physiotherapy fields and their importance as well. Okay, so core branches of physiotherapy are first topic. Musculoskeletal, neurological, cardiopulmonary, pediatric, geriatric, women's health, and sports physiotherapy. First introduction. Physiotherapy is a diverse and specialized medical science that focuses on movement, function, and recovery. Over time, it has developed into various branches, each focusing on a specific system or patient profile. Every branch uses a unique combination of techniques, exercises, and therapeutic approaches to help patients live better, pain-free lives. So, next is musculoskeletal orthopedic physiotherapy. Its definition is musculoskeletal or orthopedic physiotherapy deals with bones, muscles, joints, tendons, and ligaments. The framework that supports and moves the body. Okay. What is the focus areas for musculoskeletal orthopedic physiotherapy? The focus areas include fractures, sprains, and joint injuries, arthritis and joint stiffness, back and neck pain, post-surgical rehabilitation after fracture fixation or joint replacement, posture correction and ergonomic training. Okay. Then treatment methods includes manual therapy and joint mobilization, strengthening and flexibility exercises, heat or cold therapy, ultrasound, TENS, TENS, transcutaneous electrical neuromuscular stimulation, posture correction and functional retraining. Now, example, a patient with low back pain learns core strengthening and posture correction to prevent recurrence. Next, neurological physiotherapy. Neurological Physiotherapy focuses on patients with nervous system disorders involving the brain, spinal cord, or peripheral nerves. Okay. Its common conditions may include stroke, cerebrovascular accident, okay, Parkinson's disease, multiple sclerosis, spinal cord injuries, facial palsy, and peripheral nerve injuries. Its treatment methods: balance and coordination training, gait training, walking re-education, okay, muscle tone regulation, next spasticity or facility control, neuroplasticity based exercises, use of assistive devices and sensory stimulation. For example, a stroke patient practices balance and walking with guided exercises to restore mobility and independence. Next, cardiopulmonary physiotherapy. Cardiopulmonary or cardiothoracic physiotherapy deals with heart and lung conditions to improve breathing, efficiency, circulation, and endurance. Its common conditions may include post-heart surgery rehabilitation, CABG, valve replacement, asthma, COPD, pneumonia, chest infections and bronchitis, and post-COVID or ICU rehabilitation. Treatment methods may include breathing exercises like diaphragmatic, pursed lip, chest physiotherapy and percussion, postural drainage, aerobic and endurance training, oxygen therapy, and early mobilization. Its example may include a post-COVID patient performs breathing exercises and gentle aerobic training to regain lung capacity. Okay, next, pediatric physiotherapy. Pediatric physiotherapy focuses on infants, children, and adolescents with movement problems due to growth, development, or neurological issues. Common conditions may include cerebral palsy, developmental delay, clubfoot, Down syndrome, muscular dystrophy. Treatment methods that are play-based exercises and activities, posture and motor skill training, stretching and strengthening programs, gait training and balance exercises, parental education and home exercise guidance. Okay, now example. A child with cerebral palsy is guided through fun balance activities to improve coordination and walking ability. Next, geriatric physiotherapy. Geriatric physiotherapy deals with the elderly population, helping them stay active, independent, and pain-free as they age. Common conditions may include osteoarthritis, osteoporosis, balance problems and fall risk, post-fracture or joint replacement recovery, Parkinson's and Alzheimer's disease, general weakness and mobility loss. Treatment methods may include strength and balance training, fall prevention exercises, function mobility and walking re-education, joint protection and pain management, breathing and endurance exercises. So examples of geriatric physiotherapy is an elderly patient practices balance and walking exercises to regain confidence and prevent falls. Next is women's health and pelvic floor rehabilitation. Its definition is this branch focuses on women's physiotherapy health. This branch focuses on women's physical health across all life stages, from pregnancy to postmenopause, emphasizing pelvic floor strength, posture, and hormonal changes. Common conditions may include back and pelvic pain during or after pregnancy, pelvic floor weakness or urinary incontinence, post-surgical like C-section, hysterectomy, okay, post-surgical rehabilitation, okay, hormonal-related musculoskeletal issues, PCOS-related fitness and metabolic issues. Treatment methods may include pelvic floor muscle training like Kegel exercises, postnatal and antenatal exercises, postural correction and core stability training, breathing and relaxation techniques, education about safe physical activity during pregnancy. Its example may be a new mother learns safe exercises to restore core and pelvic strength after delivery. Next, sports physiotherapy. Sports physiotherapy focuses on athletes and physical active individuals, aiming to prevent, treat, and rehabilitate sports-related injuries. Its common conditions may include muscle strains, ligament sprains, and tendon injuries, ACL tears, and shoulder dislocations, overuse injuries like tennis elbow, runner's knee, post-surgical sports rehabilitation. These are common conditions. Now, treatment methods including sports physiotherapy, sports stepping and bracing, strength and conditioning programs, agility and flexibility training, injury prevention education, return to sport rehabilitation plans. For example, a football player receives rehab for an ankle sprain and a strengthening program to safely return to play. Next, specialized and emerging fields in physiotherapy. Our next topic, vestibular rehabilitation, pain management, palliative care, oncology rehabilitation. So its introduction. Physiotherapy is constantly evolving, moving beyond traditional rehabilitation to advanced and specialized fields that address complex health issues. These emerging areas show how physiotherapists play a crucial role in multidisciplinary healthcare, improving patients' function, comfort, and quality of life in even the most challenging conditions. Vestibular rehabilitation therapy, VRT. Vestibular rehabilitation is a specialized branch of physiotherapy that focuses on balance disorders, dizziness, and vertigo caused by problems in the inner ear or brain. The goal is to reduce dizziness, improve balance, and restore normal movement and confidence. Common conditions that should be treated are benign paroxysmal positional vertigo, BPPV, Meniere's disease, labyrinthitis and vestibular neuritis, post-concussion dizziness, balance problems in elderly or neurological patients. Treatment techniques may include canalate repositioning maneuvers like APTA or cement or BPPV, gaze stabilization exercises to train eye and head coordination, balance and gait training, habituation exercises to reduce motion sensitivity, education and safety training for preventing falls. Each example may include a patient with vertigo after turning their head feels dizzy. After a few sessions of canalate repositioning, symptoms are resolved and balance improves. Its example, a patient with vertigo after turning their head feel dizzy. After a few sessions of cannabis repositioning, symptoms are resolved and balance improves. I hope you can understand. That's why I repeat twice. Pain management physiotherapy. Next is pain management physiotherapy. Pain management in physiotherapy focuses on reducing acute and chronic pain through non-surgical and drug-free methods. It combines physical techniques with patient education to restore movement, reduce discomfort, and prevent recurrence. What common conditions can be treated? Chronic low back pain, cervical spondylosis, fibromyalgia, post-surgical pain, osteoarthritis, and joint pain. Treatment techniques may include manual therapy and joint mobilization, electrotherapy modalities like TENS, ultrasound, IFC, laser therapy, dry needling and cupping where applicable, kinesio tapping for support and pain relief, posture correction and ergonomic advice, patient education about pain mechanisms and self-management. Examples would be a patient with chronic neck pain from long computer hours learns stretching, posture correction, and ergonomic sitting techniques to relieve and prevent pain. Next is palliative care physiotherapy. Palliative care physiotherapy focuses on improving the comfort, mobility, and quality of life for patients with life-limiting or terminal illnesses such as cancer, end-stage organ failure, or neurodegenerative diseases. The goal is not just physical recovery, but comfort, dignity, and emotional support. Common condition that should be treated in palliative care physiotherapy is advanced cancer, multiple sclerosis late stage, end-stage heart or lung diseases, muscular dystrophy, Parkinson's disease, advanced stages. Treatment techniques may include breathing and relaxation exercises to reduce anxiety, gentle stretching and positioning to prevent stiffness, bed mobility and transfer training to improve independence, pain and fatigue management, emotion support through movement and comfort care. For example, a late-stage cancer patient learns light breathing and relaxation exercises to ease pain, improve comfort, and reduce fatigue during treatment. Next is oncology rehabilitation. Oncology rehabilitation is basically a growing branch of physiotherapy that supports patients before, during, and after cancer treatment, helping them regain strength, mobility, and confidence. Physiotherapists play a major role in reducing side effects of chemotherapy, radiation, and surgery. Common conditions treated in oncology rehabilitation are post-mastectomy, shoulder stiffness and lymphedema, weakness and fatigue after chemotherapy, scar tightness and mobility loss, balance problems due to neuropathy, pain and reduced endurance. Treatment techniques could be manual lymphatic drainage and compression therapy for lymphedema, range of motion and stretching exercises for post-surgical stiffness, fatigue management and gradual strengthening, breathing and relaxation techniques, patient education for home-based recovery and safe exercise. For example, a breast cancer survivor with arm swelling receives physiotherapy for lymphatic drainage and shoulder mobility, helping her regain independence and confidence. Next, significance of these emerging fields. Expanding the role of physiotherapists beyond traditional rehab, enhancing interdisciplinary collaboration with doctors, nurses, and psychologists, providing emotional and physical healing to patients, promoting holistic healthcare, treating not just the disease but the person. Now, we can say that in simple words, modern physiotherapy is not limited to muscle and joints. It now supports patients with dizziness, chronic pain, cancer, and terminal illness. These emerging fields show that physiotherapists heal with both science and compassion. Okay. Our third topic is roles, techniques, and clinical examples from each domain. Practical insights from core and specialized physiotherapy fields. So, introduction. Physiotherapy is not just theory. It's a hands-on, evidence-based profession. Each branch of physiotherapy involves specific roles, techniques, and clinical reasoning tailored to the patient's condition. The physiotherapist's role changes depending on whether they are treating a stroke patient, athlete, child, or post-surgical case, but the core goal always remains the same: to restore function, reduce pain, and enhance quality of life. So, musculoskeletal orthopedic physiotherapy. What is the role of physiotherapy in musculoskeletal orthopedic physiotherapy? Assess posture and joint mobility and muscle strength, diagnose movement dysfunctions, relieve pain, restore mobility, and prevent future further injury that cause in future. Okay. What are the key techniques? Manual therapy, like joint mobilization and manipulation, soft tissue massage and trigger point release, strengthening and flexibility training, electrotherapy like TENS ultrasound, posture correction and ergonomic training. Okay, so the clinical example: a 35-year-old office worker presents with neck and shoulder pain due to prolonged sitting. What will be the possible treatment for that? The physiotherapist uses posture correction, stretching, and TENS therapy, along with ergonomic advice to prevent recurrence. Okay? So the next is neurological physiotherapy. The role of physiotherapy in neurological physiotherapy is help restore movement, coordination, and balance, retrain the nervous system using neuroplasticity principles, improve independence in daily activities. Key techniques: task-specific exercises like walking, reaching, hand to mouth, okay? Proprioceptive neuromuscular facilitation, PNF, balance and gait training, constraint-induced movement therapy, functional electrical stimulation, FES, okay? These are the key techniques. Now the clinical example. Listen carefully. A 60-year-old male recovering from a stroke has weakness on the right side. The therapist uses, what should the therapist do? Therapist should use PNF, balance training, and mirror therapy to retrain coordination and walking ability. Okay. Next is cardiopulmonary physiotherapy. What is the role of physiotherapy in cardiopulmonary physiotherapy? Improve lung function and cardiac endurance, prevent complications after chest or heart surgery, promote early mobilization and functional recovery. Okay, now the key techniques: breathing exercises, diaphragmatic and segmental, chest physiotherapy and postural drainage, airway clearance and incentive spirometry, aerobic exercises programs like walking and cycling, relaxation and breathing control training. Okay, now the clinical example: a 55-year-old post-heart surgery patient. Okay, post-heart surgery patient. Okay, after the surgery. Okay, struggles with deep breathing, difficulty in breathing. The physiotherapist teaches what? Incentive pyrometry, supported cuffing, and gentle mobility, okay, to enhance lung expansion and reduce risk of pneumonia. Okay, next is paediatric physiotherapy. If you have any question, you can ask in the comment section as well. Okay. What is the role of physiotherapist in pediatric physiotherapy? Support the physical development of children with disabilities or developmental delays, encourage play-based movement and coordination, guide parents for home exercise programs. Okay, the key techniques: neurodevelopmental therapy (NDT), sensory integration therapy, strengthening and flexibility exercises, play-based functional training, posture correction and gait training. Okay, next, clinical example. I always say listen to the clinical examples and think about that carefully. You should know how to diagnose. A 4-year-old child with cerebral palsy has difficulty standing. Through play-based therapy, and gait re-education, the therapist helps improve balance, walking, and confidence. Okay, next is geriatric physiotherapy. What is the role of physiotherapist in geriatric physiotherapy? Maintain mobility, balance, and independence in elderly patients, prevent falls and injuries, manage pain and chronic conditions like arthritis. Key techniques: balance and coordination exercises, resistance and strengthening training, stretching and flexibility programs, functional retraining, like bed to chair transfer, okay, bed to chair transfer, stair climbing. Okay, next, education on home safety and mobility aids. Now, the clinical example. A 70-year-old woman with knee osteoarthritis complains of difficulty climbing stairs. Okay. The therapist designs a strengthening and balance program, uses heat therapy, and teaches joint protection techniques. Okay. Now, next is women's health and pelvic floor physiotherapy. What is the role of physiotherapy in women's health and pelvic floor physiotherapy? Assist women during pregnancy, after childbirth, and post-surgery, strengthen pelvic floor muscles and improve posture, manage pelvic pain and hormonal-related conditions. Now, the key techniques: Kegel and core stabilization exercise will be done. Breathing and relaxation training should be given. Manual therapy for pelvic alignment, posture and ergonomic advice for pregnancy, postnatal rehabilitation exercises. Okay, now the clinical example. A 28-year-old postpartum woman complains of urinary leakage after delivery. The therapist teaches pelvic floor strengthening because her pelvic floor muscles are weak. Okay, therapist should teaches her breathing exercise and posture correction for recovery. Okay. Now, next is sports physiotherapy. What is the role of physiotherapist in sports physiotherapy? Prevent, assess, and rehabilitate sports-related injuries. Optimize athlete performance and conditioning. Plan safe return to sport programs. What are the key techniques? Sports, stepping and bracing, dynamic warm-up and stretching routines, plyometric and agility training, injury prevention education, post-surgical rehabilitation programs. And a clinical example, a football player suffers an ACL tear. After surgery, the physiotherapist provides strengthening, balance, and agility training, gradually preparing the athlete to return safely to competition. Next is vestibular rehabilitation. What is the role of physiotherapy in vestibular rehabilitation? Manage balance and dizziness disorders, improve stability and visual focus, reduce vertigo and motion sensitivity. What are the key techniques? Happily maneuver gaze stabilization and head movement exercises, balance retraining, habituation therapy. Okay. These are the key techniques. Now the clinical example. A 45-year-old woman experiences vertigo when rolling in the bed. After performing the Apley maneuver, her dizziness reduces significantly within 2 sessions. Okay. Now the pain management physiotherapy. What is the role of physiotherapist in it? Identify and manage the root cause of acute or chronic pain, reduce dependence on medication, educate patients on posture, ergonomics, and lifestyle medication. Educate patients on posture, ergonomics, and lifestyle modification. Key techniques, manual therapy and soft tissue release, electrotherapy and laser, dry needling and cupping where appropriate, core stabilization and stretching, cognitive and relaxation techniques. Okay. What is the clinical example? A late-stage cancer patient receives gentle limb exercises and breathing training to ease pain, reduce stiffness, and enhance comfort during care. With pain management, physiotherapy, key techniques, again I am repeating, kindly note down. Key techniques may include manual therapy and soft tissue release, electrotherapy, TENS, laser, dry needling and cupping where appropriate, core stabilization and stretching, cognitive and relaxation techniques. Okay, an example for pain management physiotherapy. Clinical example. A 40-year-old man with chronic low back pain is treated with core strengthening, ergonomic correction, and TENS therapy, leading to long-term pain relief. Okay. Now the palliative care physiotherapy. The role of physiotherapy in palliative care is improve comfort, breathing, and independence in terminally ill patients, support emotional and physical well-being, educate caregivers for safe handling and movement. Now, key techniques, gentle passive movements and stretching, breathing and relaxation therapy, positioning for comfort and circulation, bed mobility and transfer training. Now, the clinical example, a late-stage cancer patient receives gentle limb exercises and breathing training to ease pain, reduce stiffness, and enhance comfort during care. Now, the oncology rehabilitation, the role of physiotherapy in oncology rehabilitation is help cancer survivors regain strength, mobility, and confidence, manage fatigue, lymphedema, and stiffness after treatment, promote physical and emotional recovery. Okay, now the key techniques, manual lymphatic drainage, scar management and stretching, strength and endurance exercises, breathing and relaxation sessions, fatigue and stress management programs. In the clinical example, a post-mastectomy patient develops arm swelling, lymphedema, The physiotherapist uses lymph drainage, compression, and gentle stretching to reduce swelling and improve arm function. Okay. Now, assembly. And you can take a look here on assembly. These are the branches, focus area, example, and condition. Key techniques that are used. Next, these are the fields, focus area, example, condition, key techniques. You can take a look at it. This is assembly, the activity. Now you have to write about your interest, about the topic you like the most, you think you can work on, you think you can take this topic as your profession in the future. You can do master, you can do specialization in that topic, you can do some research on that topic. So you can choose the topic and give your view, your motivation about the topic in the comment section. That's all for today. Day 2 is complete. Now we can meet in day 3. Thank you so much. And Allah Hafiz.